I want to welcome everyone. Thank you for attending the annual meeting of Global Offsite Care. This will be an opportunity to hear a little bit about what we've been doing this last year and what we hope to do in the near future. You'll hear about resources we've gathered to support telemedicine projects and to expand our reach. You'll hear how we pivoted in response to the pandemic and what we have done even while remaining socially distanced. We have some exciting new directions to report on, and you'll hear about new initiatives we propose to undertake this year. And now I'll introduce our board of directors. First, there's myself, Michael Cook. I'm president of Global Offsite Care. Also present, we have Gail Thomas, who's one of the three founding members of the board. Brian Bauer is the third founding member. John Putman joined the board soon after we got started. He has a background in telemedicine technology in particular, and he raised his hand and we invited him to join the board. Princess Frances Kamalea is also an avid promoter of telemedicine. We met her early on and she joined the board, and she represents Nigeria and Africa in general. She is a psychiatrist, a medical doctor, now retired from a major hospital in Nigeria. We have Dr. James K. Good, also a medical doctor and really the inspiration for what we're doing, because we're building on his desire to extend his telemedicine practice worldwide and share what he knows and share his enthusiasm for the potential in telemedicine. We have Chemo Jim Becker.
Aloha.
He's been on the board for a while, and he's also the primary project advocate, especially in Asia. So he's somebody who is engaging a lot of new faces and organizations, and we've expanded a lot because of his efforts.
Thank you, Michael.
Jim Simons. Welcome. And Jim
Hello.
Simons, also on the board. He's our treasurer, and he's somebody I turn to a lot for saying, really, can we spend money on this? And he's good guidance, keeping us out of trouble.
Thank you, Michael.
And we have Stephen Powell with us. He's the secretary of the board. He's been on the board for several years. He's traveled to several of our projects. And he's always good support and has kept us on an even keel. I appreciate his presence. Thank you, Stephen. So we'll proceed with the program, but first let's have a little fun. Farheen, let's see who gets the first prize. You're muted, Farheen.
No, I am making sure I did not miss anyone. So let me see here. So I basically did a little wheel of names thing here, and I'm going to share my screen so you all can see it. And so whoever is a part of this meeting currently has been entered to win a $25 gift card. This is the first one. There's 2 more coming up. And so I'm going to click to spin, and we will see who wins.
What fun.
That's fun.
Colorful.
Who is it? Who is it?
Oh, John, the guy.
Hey.
Congratulations,
Very
Dr.
good.
I will message you separately so that we can get you that gift card.
Nothing like a little gambling to start.
Farheen, I will split if next is me.
Will do. Great. So next
Hey.
we have Jim Simons, who will be giving an overview of our finances. Jim?
Okay. Yeah, pull up a slide. Yeah, this last year was a tough year because of the pandemic. And so I cut down our travel, cut down some of the things we're doing. So we turned around and tried to spend a little time, or quite a bit of time, on our fundraiser, and did very, very well. We grossed 91. We actually netted down 59, but it was a very, very successful fundraiser. The Rotary clubs, we collect some of the monies, but most of the monies go directly into the project. Sometimes they filter through us. So the Rotary clubs, that number doesn't represent all of the money that comes in, but some of it. The board members, foundation grants, and individual corporations is also what kind of keeps us going. Go ahead and slide. As you can see, the big part of our cost was fundraising for that large fundraiser. We put a lot in there, but our administrative costs are very low. Our CME certification is something that we've put a lot of effort into. Of course, we have the annual meeting, and the projects, we're starting to put in more money. And by turning around and having the fundraising that we had, we're going to be able to do a lot more. So it's kind of set us up for the current year to really move forward on some things. We already started the fundraising for the next year and hope to be successful there, but we plan on spending a lot more time on projects this year. That's it.
The
Great,
briefest
thank you so
treasurer's
much.
report I've ever heard. Very good, Jim.
Thank you very
Money
much.
came in, money went out.
So for the next segment of the meeting, we're going to be talking about our key events and accomplishments in 2020. And so first up, we have Dr. James K. Good, who will be talking about the Global Grand Rounds COVID-19 series.
Hello, everybody. And it's been my pleasure to join Global Offsite Care because if you want to practice global medicine, you can't do it in your backyard. You need to get to Nepal, Democratic Republic of Congo, and all around the world. And this organization allows us to do that. And one of our ways of outreaching is to give grand rounds. This last year, we gave 35 COVID-19 rounds. In fact, we're having rounds this Wednesday about in Mexico that there's a oxygen shortage. And in Mexico City, it's very hard to get oxygen if you are a COVID-19 patient. And I'm going to talk about the ethics of who gets the oxygen. And Dr. Andrew Wagner, who's an ethicist, is going to join me. These are the type topics we have, very real, earthy topics. We've had some wonderful guests, Dr. Phil Eskenazi from Yale. He's head in the Department of Immunology, and others. Dr. Fedson had been head of medicine at the University of Virginia. These are all colleagues who've given us special lectures. And as Farheen points out, the thing that's really helped us is we've prevented the graying of ground rounds by getting off of me and getting on to some younger, very good discussants. So I'm enjoying grand rounds more than ever, listening as opposed to giving every week. Education is our forte. Next, we try to do consultation, work at the individual hospitals. And lastly, we'd like to do something in terms of the hospital management electronic medical record within each hospital done through some microfinancing. That's a whole new project. And Farheen, I did that in 1 minute.
You have one more slide. You can talk a little bit about the highlights.
Yeah, these are some of the highlights that we had. For example, this was the skin signs of COVID-19. We tried to look at all the different aspects of COVID-19. In fact, you might say that global offsite care has been defined as a resource, and we have a hotline. You can call this line anytime, and we have an intensivist who really is quite versed in COVID-19 available to give advice or consultation. It's been used by some folks in Nepal and India and Africa. It is available, and we're very proud of our doing the best we can to face up to COVID-19. But we're having this interspersed in our future lectures, but we have more variety now, and I'm getting off of just COVID-19. Education is, I think, our forte.
Great, thank you very much, Dr. Good. Next, we have myself, and I will be talking a little bit about our virtual Pinot and Pizza this past July 2020. So as you all know, because of COVID, we had to rapidly shift our fundraiser from an in-person fundraiser that was supposed to be held in the beautiful Paradise Ridge Winery, and we pivoted in a couple months to create this kind of online fundraiser. And so we tried to do something kind of different. In other kinds of online fundraisers, they would have, a YouTube video live stream where anyone could really watch it. But we wanted to do something more intimate, where folks would come onto Zoom with little bitter paddles, as you can see in this little slide. And they had the opportunity to engage with one another, to talk to each other, and to bid live on these, these really fabulous packages that we had. And so, another thing that we did is that because it's the Pinot and Pizza event, we, especially the folks who are in Sonoma County, they could come pick up their really lovely bottle of Pinot and a fresh cooked pizza. And then for the folks who are, not in Sonoma County, we shipped them a Pinot bottle. So it was a very fun event. We sold, 79 tickets. We had 54 people attend, and we raised $59,000 for the organization, which is absolutely incredible. And we are so grateful. Many of you participated in this fundraiser and donated, and we are so incredibly grateful for you, because now we can do so many different programs that we've always wanted to do. And so throughout this presentation, and you will see kind of what's kind of in store for 2021. And we are really excited. So again, thank you all very much. And next we have Chemo Jim Becker, who's going to be talking a little bit about the Nepal Vocational Training Team modification. Chemo Jim?
Thank you, Farheen. Good job. And we appreciate everyone being here. Yeah, I want to go back a little bit, because this Nepal Vocational Training Project is a Rotary Global Grant, and we initiated that in July of 2019. And that's to provide global telemedicine equipment training to 6 Nepal hospitals. And during the same time, we invited 6 medical doctors to come and visit the San Francisco Bay Area and go through extensive training, which I believe we have 2 doctors with us today from that training, Dr. Pradeep and Dr. Prakash. This training included advanced hands-on techniques in some of the best things we do with the telemedicine and using the apps and whatnot. Next one there. And so I just wanted to mention too, because this project is still ongoing today, we didn't spend all the money in this global grant, so we did a modification. And one of the things that came out of this, of course, the pandemic and everything occurred, was an amazing connection among the doctors there in Nepal. And what we were able to develop was a teleconsultation component. And that allowed us to reach out to a couple of rural hospitals in Nepal. As you can see in the copy, we've got the teaching hospital and Nepal National Hospital they are our resources, but the rural parts of Nepal is where there's not a lot of medical services. So through leveraging technology and being able to use our docs, a magical thing that happened for us, and we'll have Dr. Prakash, I think, and Dr. Pradeep can also verify this, is the camaraderie among those doctors and their ability to communicate with each other. So that really opened up our teleconsult component, and to make it even a more effective way to treat patients especially in rural Nepal. We also, in the modification, we added a central monitoring system. We call it a CMS. And this allows docs from both hospitals to take a look at what the patient issues are, and to try to develop a good strategy on dealing with that patient's problems. So, and then finally, I just wanted to mention that we, in this last slide, we have the representatives from those teleconsult hospitals that are part of this amazing global grant. This global grant is now recognized at the Rotary Foundation as one of the top global grants, and we're getting not only recognition from the Rotary Foundation, but all over many other countries are supporting us, including we've got our friends here from Australia, from China, from Thailand. So we've got a great deal, and from the Philippines now, we've got amazing support. So I think, and we couldn't do it with a lot of you supporters that are on this call. So much mahalo from here in Hawaii for continuing to support our global telemedicine projects.
Great, thank you, Chemo Jim. Next, we have Michael, who's going to talk a little bit about our Rotary Magazine December 2020 article.
Yes, we had an article back in 2017 and thought we were blessed to get that. And then we got a phone call last year to inquire about doing another story. And so we had the opportunity to have an article come out in Rotary Magazine, which has international distribution, and got a great shot of Dr. Jude in there. And that same issue, which was in December 2020, had a short story focused on Dr. Prakash Pajal, who was the team leader of the Nepal VTT.
Great, thank you, Michael. Next, we have Jamie Simons and myself, who are going to talk a little bit about our needs assessment. Jamie, go ahead and unmute yourself.
Thank you. So Farina and I last year worked on having a needs assessment where we reached out to our project partners around the globe and asked for a little bit of their time to talk about their experience with global offsite care and the work that they're doing in telemedicine. So we were able to connect with 16 project leaders at 14 project sites and met them anytime that they were willing to meet with us. A lot of coordination across the globe, but some of the biggest takeaways that we had, 9 out of our 12 hospitals talked about telemedicine as being part of global grand rounds, which was really insightful because global grand rounds is based on education weekly. And so our doctors get to come and collaborate and share their case studies of patients that they're seeing in their hospital. And, as Dr. Good mentioned, we've had some great grand rounds on COVID. But there's a difference between attending a weekly education event and doing telemedicine. And so we really wanted to ask our partners, how are they doing telemedicine on the ground? And so we got a lot of insight. 8 out of the 11 individuals that we interviewed also talked with the grand rounds that they wanted more variety of presenters and that they're doing teleconsults. 78% of our partners are doing teleconsults, but we had a variation of how many of our partners were using some of the technology equipment that we had provided. And we had a variation of feedback of what our partners were interested in having or what support they wanted from global offsite care to do telemedicine.
Great, and I would like to just showcase a few really awesome photos that we took of our conversation. So shout out to Dr. Obikize of the Federal Medical Center in Yanagwa, who is on the call. I think it's, close to, again, 3 o'clock in the morning his time. So thank you for joining, as well as Dr. Peniel Kasongo from the Democratic Republic of Congo, who is also on the call, and it's 3 o'clock in the morning his time. Thank you both so much for joining us today and for doing the needs assessment. And we also have a little picture of Dr. Emmanuel Indikayayo, and he is with the Shira Hospital in Rwanda. And funny story, the way I found him was that he did a grand rounds, 2 years ago, and I remembered him. And I searched him on Facebook and I found him and messaged him and asked if we could interview him for this needs assessment. So he was very gracious, graciously accepted, and has now been a participant of Global Grand Rounds ever since then. So we're really excited for, again, that needs assessment. We're really thankful for all of the folks that we interviewed, and are, really, truly thankful that we can continue those partnerships. So thank you, Jamie. Great, so now we have another raffle. Are you all ready? I'm gonna, hold on, add one more person into the room who just joined. So we're gonna do another raffle for a $50 gift card. Let me reshare my screen. Let's see here. Okay, so are you all ready for raffle number 2?
We're ready, Farine. Yes.
Okay, let's see who gets it. Oh.
Oh, Lauren. Good.
Congratulations,
Exciting.
Buy a couple books, maybe.
Thank you. Hello, everybody.
Lauren. Congratulations, Lauren.
Great. So Lauren,
Lauren's
I'll
a
connect with
medical
you. I'll connect with you a little later, and we'll get you your gift card. Congratulations.
Thank you.
Great. So going back to our presentation, we're going to be talking a little bit about, again, exciting news for 2021. So first up is Kimo Jim Becker, who's going to be talking about our Zamboanga City, Philippines pilot project launch.
Thank you again, Farheen. Yes, we call it Z City. It's a little easier to say and pronounce and spell. But this is a pilot project that we are developing with sort of the hub and spoke concept using, and I'm going to call it Z City Medical Center. Z City, again, Zimbabwe. I can barely spell it and hardly even say it. But this is making this 500-bed hospital the center component of this pilot project. And using what we've learned in Nepal and also in Nigeria, in other parts of the Caribbean, the hub and spoke, or the rotary wheel for my rotary friends, if you can just think about that. And the centerpiece would be the Z City Medical Center. So what we're now collaborating, we've got some great partners, including the Rotary Club of Z City West and the Rotary Club of Calgary. So we've been discussing on a weekly basis for a good 6 months now, talking about building a global grant, much like the one that we're modeling after for Nepal. So next slide. And the whole idea is to develop that relationship with the Z City Medical Center. We've got a wonderful hospital director, medical doctor, Dr. Afdal, who's is in this slide. It's hard to see. But we've got what I call champions, like we have in Nepal and other places around the globe. We also have a Rotarian, Fernando Yi, and he's developed a number of global grants already between the Rotary Club of Calgary, the Z City Medical Center, and his Rotary Club of Z City West. So when you get a team situation like that, it's phenomenal. And I think that we're very, very excited about that relationship. And what's unique about who we have as players in developing the global grant, the two Rotarians from the Calgary Club, Sonny, who's a retired medical doctor, and Gerard, a tech expert. It's great to have the balance. Those two have done a number of global grants together, including some VTT, that's vocational training team. So myself, Michael, and Farheen have been participating with those Rotarians, as well as Dr. Aftel, who I think is a Rotarian as well. So our first pilot project is to develop a relationship in the rural hospital just outside of Z City. So it's the same kind of thing. And once we get that pilot off the ground, we're going to draft up a global grant, and that should be ready for the Rotary years run July through June. So pretty much everything's tapped out this year, but we expect to have on board this new global grant next Rotary year, so beginning after July 1st. So that's very exciting. And I think that's it for me. Let's see, what else do I have? The other thing that I just wanted to say about the Philippines is that it's a lot like California geographically. It's kind of long and narrow, but it's got bodies of oceans around the islands. So I know all of you are thinking about technology and how to leverage that technology for medical help, especially with the pandemic and all that. But when you think of the Philippines, it has so much potential because of the population and the population spread around that country and the lack of medical services, especially in some of the rural parts. We're finding with the global telemedicine reach that we're not only effective in metropolitan areas, but when we get a wonderful hospital like Z City Medical Center and a wonderful administrator who's on board and very excited about doing this stuff, it really gives us the potential to really serve some rural communities, some areas that may have not had the medical support that can be done with leveraging technology. I think that's it for me.
Great. Thank you, Timothy. So next we have Dr. Good and I. We're going to talk a little bit about Global Grand Rounds and how we are inviting international speakers. So if I can start, and then Dr. Good, if you could help me out. So one of the main feedback points that we received from the needs assessment was the need to have more diverse presenters. As much as, we love Dr. Good, Dr. Good's presentations are awesome. It also is great to hear from our partner hospitals and regions specifically about what they're facing. And so what we have been doing with the Global Grand Rounds team, so shout out to Lauren Anderson, Wumi Adelepi, I think, and Alexa Groom, we are actually, contacting all of our partner hospitals and inviting doctors to present. And so we've had really awesome presentations. So another shout out to Dr. Obikize, who gave a wonderful presentation about contact tracing in Nigeria. We have again, Dr. Emmanuel, who is an OBGYN in Rwanda, and he gave a phenomenal presentation about hypertensive disorders. And we even had Dr. Biniak Dangal of the Bhaktapur Cancer Hospital in Nepal give a fantastic presentation about how he managed COVID-19 at home with his mother. So we're really excited about this kind of international series. Dr. Good, do you want to add anything?
I do, I really do. The United States is only 5% of the world. And what we're trying to do is open up to that other bigger percent. And just the participants in this meeting, really from Nigeria, Inagwa Hospital, from Kolwezi, the Mamatapatha Hospital, from Uganda, the Kabale Hospital. All these different hospitals have much to offer. For example, I can't think of any other place where I've seen in the last several years a real case of polio. We had polio presentations. A case of tetanus. When is the last time a U.S. doctor really has seen tetanus? Diverse topics, for example, malaria, which is a major problem in the world. We know very little about in the Bay Area, but it expands what we know from our colleagues, and we've opened the door in terms of these international topics. And I welcome any of you listening. If you have a topic, we have a editorial board. You just give us the topic. We'll go over it. We'll fit it into the rounds in terms of a good time. But the rounds have really diversified, become more global, and it's been a great improvement. And Vereen, I thank you for doing that. And Jamie, I think you brought really fresh blood and criticism that led to us broadening our topics and really having the participants give the rounds when they like it. And it's really a great improvement.
Great. Thank you, Dr. Good. So next we have a little presentation about our mini grant initiative from Michael Cook and Dr. Joey Prosper. So Michael, why don't you begin? And then Dr. Joey, please talk a little bit after about the iPad you received.
All right. Well, thank you. The mini grant is really a new initiative from us in response to really talking to people around the world about what they think telemedicine amounts to, and also the fact that so many more people now have experienced telemedicine themselves, that mostly we think of it as patient talking to a doctor. And previously we had emphasized mostly inpatient care and doctors advising each other how best to take care of a patient. And we wanted to expand it. So we added this new program that will help us get in touch with and support and encourage doctors who are providing direct care to patients. And we kicked off this program. Our initial awardee is Dr. Joey Prosper, who's based in Haiti, and you'll hear from him in a minute. But we're just getting ready now to launch the program generally and look to our partners to help promote this program and get us acquainted with more doctors who are on the front lines providing telemedicine wherever they are. Dr. Joey?
Great. Dr. Joey, please talk a little bit about this.
Yes, thank you very much, Michael. It was great, and Farine, thanks for everything. You know, I've been practicing telemedicine since 2010 in Haiti, and we depend on iPads and computers. And two of our iPads were broken, and one of our laptops as well. And thanks to that mini grant, we were almost paralyzed for that. One of the pictures that you could see right here is us using the tablet that is fixed now to do an ultrasound and sending that ultrasound to a radiologist, and that radiologist will send us the result in real time. And so forth. We do the same for an ear specialist. And the third one at the far right is where I'm examining a result that was sent to me by one of my physicians that was in mobile clinic. And he had some issues that he wanted to share with me through telemedicine. And again, thanks to these equipments, we are able to identify these diagnostics and start treatments for these patients. And this is, I can express how valuable this mini grant is, but not just the mini grant itself, everything. And Dr. Good is very familiar with me. Whenever we have challenges, we always, I always, point out these questions to him. And he has been very, very supportive, him and his team. So I truly thank you for that. And also, I would say the Haitian community in general.
Great, thank you, Dr. Joey. We are so grateful that you are a part of our team as well.
I'm happy to be.
Great. So next, I am going to be talking to you all a little bit about the Director of Operations, which is me, and our new volunteers that we just onboarded a few weeks ago. So hi everyone, my name is Farheen. I am the newly appointed Director of Operations of Global Offsite Care. I started with Global Offsite Care about 2 years ago. And I, after Michael and Dr. Good gave a presentation to my Rotary Club, which is the Rotary E-Club of Silicon Valley, and I really fell in love with the organization and wanted to help them in any way I could. So I started out as their kind of, communications director, trying to see if we could, drum up more excitement via social media. But as the years continued, my job kind of morphed into doing a lot of other things, such as, helping with telemedicine projects and managing global grand rounds. And so I have been very fortunate to be appointed, the director of operations for the next few months, so that I can help, help global offsite care and global telemedicine grow. And so some, fun news for you all. I recently got accepted into medical school. And so I will be joining the League of Physicians. So I think that right now it seems that I will be going to UC Davis this fall. And so I'm really excited, but what that also means is that unfortunately I have to leave global offsite care. And so, one of the things that I am really hoping to do is to inspire kind of the volunteers that we have to kind of help the organization grow even more. And so I wanted to kind of just showcase how we onboarded about 15 new volunteers. So I wanted to, there's some of them on this call right now, so I wanted to give them a little shout out. So with the communications team, we have Emma and Gracia. With Global Grand Rounds, we have Alexa, Wumi, and Lauren. Fundraising is Vivian, Katie, JP, Gonche, Lauren, and Monica. The telemedicine engagement liaison team is with Carson, Gracia, Tiffany, Riza, Lauren, Trina, and Emma. And then finally, we have our Dharma data manager, who is Izzy. So I want to, really shout out all of these new volunteers, really thank them for, the commitment that they have to make global offsite care and global telemedicine, hopefully an even more amazing program than it is already. So I am really, really thankful, to, again, all of you who are on this call, hopefully the people, the volunteers who listened to this recording after who couldn't make it today. I'm really thankful to all of you. And again, thank you for kind of carrying my legacy forward in a way.
Salute them. They're wonderful.
Trina, I see your hand is up. Would you like to unmute yourself and say something?
No, sorry, I did that by accident.
That's okay.
Push the wrong button, did you? All right.
Well, nonetheless, thank you, Trina. Oh wait, did I miss Trina? No, Trina, you're in there. Oh, phew, because I got really confused. Yes, so Trina is one of our telemedicine engagement liaisons. So thank you, everyone. So next, we are going to talk a little bit about Dharma platforms. So Jamie, would you like to begin?
Absolutely. So the quest to find the Dharma platform came after conducting the needs assessment. And we found that, as I mentioned, almost 80% of our sites had done a teleconsult, but we didn't have any documentation of it. And with global offsite care, we have a mission of improving public health and improving global health and improving patient outcomes, but we don't have anything tracking it. And so the drive to find Dharma was to have a tool that we could offer to all of our sites globally to be able to capture the services that they're providing to their patients. And through that process, give our doctors a tool to track and analyze the treatment and services they're providing. And then also for global offsite care to give our agency a tool that will allow us to have data that we can take and bring to potential funders and utilize in grants that can tell our team and anybody who's interested in supporting global offsite care, how many patients are being seen in Philippines through telemedicine and what services were provided. It's also a tool that can be used for global grand rounds where there's a platform on Dharma that allows to look at what patients were treated and what type of ailments they had. So that can drive even some of the new global grand round topics that we have to talk about health issues that Dr. Good has mentioned. We don't see malaria in the United States. So we can bring some of these patients that are documented in Dharma into the global grand rounds fold. So it can hold or it can have 100 users. So that's pretty great for all of the sites that we have globally. It's also a platform that our doctors in different hospitals can create their own forms. So we understand that the hospitals and clinics that we work with globally are all very unique. And some of the hospitals see, you know, thousands upon thousands or thousands of patients. Some of them are much smaller. They have specialties or not. So this is a platform that our sites can take and build out on their own. And we're starting with the Philippines with Z City. And they had said, you know, one of their greatest challenges is that when somebody is seen at a clinic and then they're transferred to the hospital, they don't know anything about the patient when they come, even though they've already been involved with trying to support with treatment. So they're going to be using this platform in the pilot, and they've built out all of their forms, and they're going to be using it between their hospital and clinic, and tracking how they're providing telemedicine. Also, Dr. Joey has agreed to pilot it in Haiti. So he's been instrumental and so supportive and just willing to you know, use the Dharma platform and give us real feedback on, you know, how it works on the ground, and if it's something that's really going to help global offsite care, you know, move in a better direction and doing telemedicine globally and supporting our sites globally that need something to help track their patient services.
Yeah, great. Thank you, Jamie. So again, a little shout out to Dr. Joey, as well as Izzy, who is going to be our Dharma data manager. And so hopefully, you know, we're really excited about this tool. And, you know, as Jamie mentioned as well, we're really excited to also expand this to our other partner hospitals. So to the partner hospitals who are on this call today, if this is something that is interesting to you and you think that maybe you can use it, please let us know. We would love to work with you and create forms for you all as well. Great. So our next topic is going to be about the Nepal Central Monitoring System. So Chemo Jim Becker gave a little introduction to it, but Michael will be talking about it a little bit more in depth. Michael, go ahead.
Okay. Thank you. So one of the things that happened when the Nepal team came to San Francisco in 2019 was they visited a facility in San Francisco that interconnects several hospitals and allows core staff at a central location to monitor patients and 140 ICU beds around the Bay Area. And that really impressed them. And there's a lot of gear in these centers. That's great. One thing that we kept thinking of, well, that was set up with the cost of millions of dollars, you know, and so we thought, well, it's an idea of what could happen, but we didn't really have funding. And yet the team leader went back to Nepal and he said, you know, that was set up 10 years ago and the cost has come way down and we should look into this. So we have found an equipment supplier that can help send the data from bedside that, you know, whenever you see patients in a hospital on TV or something, they have all these wiggly lines, right? And that data, if it's available to a remote doctor, they can keep an eye on the patient's progress, especially at night when staff is reduced, and head off trouble. So make sure the patient survives during the night. And I thought, well, okay, great. The vendor is a Chinese firm, and I wasn't sure how widely known it was, but I went and visited my doctor at Kaiser here a month ago, and there was some of that equipment. So I thought, well, they have a global reach and a big organization that could choose anything, chose some of that. So that encourages me to think we can go ahead with this pilot project. So we want to do a proof of concept here and connect two hospitals and allow monitoring of the ICU patients from Central Hospital. In this case, it would be Nepal National Hospital would be monitoring patients at a Yeti Hospital, it's called, not far away. And that would give us that proof of concept and allow us to expand that network. It would cost about $7,000 a hospital per bed to be monitored. So it would involve substantial resources if it went much upscale, but this would give a working example that people can see and review in Nepal. And we think Nepal's government is much more sympathetic to the idea of telemedicine now that they've been through this period where the advantages of telemedicine are way more obvious.
Right. Thank you very much, Michael. And next we have a little video from Dr. Frances Kamalaga, and she is unfortunately could not make it because again it's 3 o'clock in the morning in Nigeria. But we recorded a little video, so please allow me to share the video from Princess.
Or not.
Can you all see it?
Mm-hmm.
Great.
It's coming on.
We could all see for ourselves that with the pandemic, we have seen how important telemedicine is. Because with telemedicine facility, you can reach out to a patient that you are not supposed to have direct contact with. It's a wonderful technology. The sooner we individuals and the government embrace to actually expand it, the better for us. With this pandemic of coronavirus, we've seen how useful it is. I don't know what to say in terms of thanking the senior staffs of Global Outside Care for what they have done for humanity. I feel so proud of them. And if I'm given opportunity, I'll do more. In fact, I started doing more. I have a center that I have now developed and expanded into a telemedicine college clinic. The idea, the concept of patients going to a doctor only when they are sick is no more. You should actually reach out to a doctor anytime you want so that you will be able to at least study your health profile. The center is coming up, and by the time I'm fully ready, I'm sure it will connect to a lot of hospitals that will now go into telemedicine. I thank you all, and I wish you a successful annual general meeting. I miss you all. Thank you.
Very nice.
Yeah, so Princess is one of our board members who is based in Nigeria. And so she wanted to, again, give this little video to you all. Michael, do you have any other comments you want to add?
No, I think she kind of captured those two main ideas about how the telemedicine acceptance has broadened. And we look forward to doing more in Africa with her help.
And so next we have from Dr. Good, our virtual fundraiser, Together for Telemedicine, May 22nd. Dr. Good, if you could give a few words for our upcoming fundraiser.
I hope that many of you were there last year. It was really a fine affair. We got together not exactly knowing what would happen, but we got on the stage and we presented what telemedicine does with us, and we raised, about $60,000 for the effort. We're going to have this fundraiser May 22nd. It's going to be virtual. We're going to have very good auction items. In fact, I have a second home that was just used by someone who did a bid on it, and they came back just a couple of days ago and had a good time. The concept is to have a good time in a fundraiser, and people having very valuable, unique items to bid on. We're not bidding on trips. We're not no one's going to be traveling. We did have trips part of our earlier type of offerings, but particularly having occasions of things in your home. We would set up different events in one's home. things that are unique. And I think anybody who'll attend us on May 22nd will have an experience, I hope, equal to or better than last year. So please join us.
Thank you, Dr. Good. So we have a few last things, and we're doing well on time, which is very exciting. So I wanted to turn it over to Dr. Prakash of our Nepal team to just give a few comments about his experience with, working with global offsite care, as well as how telemedicine is doing in Nepal. Dr. Prakash, are you there? If so, please go ahead and unmute yourself.
Hello, good morning, namaste, good evening to your part of the world. Working with global telemedicine has been a very wonderful experience for me, particularly because I have learned a lot and I have developed myself as a completely different person from what I was before 2019, before when we went to San Francisco area where we learned a lot about telemedicine. And that way I'm trying a bit, in whatever way I can in developing telemedicine in my part of, in my country. And what we are doing currently is we have been doing a lot of activity in telemedicine. We have been receiving global grand rounds. We have been doing teleconsultation, and what excites me most is like we have been the mini robot Kubi, which we have been using in our telemedicine. Like I have been using it in my ICU, and it has been very wonderful, and it has made my work very easier because a lot of times I cannot go to ICU each and every time. So that way it has helped me a lot. And together we are planning a lot of things. The board of directors of Global Telemedicine, especially Michael, Kimo, Farhin, and Dr. Good, Steve, all have been very supportive. And with this, we are trying to develop central monitoring system as Michael told earlier. And we are trying to make it a proof of concept that it actually works, that data from one hospital can be transferred to other hospital and it can be monitored centrally. We are trying to develop a proof of concept. If it works, if it works very good, then we can develop it to more and more hospitals. And like our future goal is to develop kind of EICU. So it has overall, what I should say, it has been a very wonderful experience. And thank you, Global Offsite Care team, and as well as I would like to thank our Rotarian friends and the different clubs in from America, and different clubs in Nepal, as well as Rotary International. So I would like to thank all. Thank you so much.
Thank you, Dr. Prakash. It has been such an honor working with you for the past few years. And I hope that I will be able to visit Nepal, to visit you and the electronic ICU and all of the wonderful things that you've been doing. So thank you very much.
Thank you.
Great. So we have two last items for the evening. So we have a closing from Michael and Dr. Good, and then we have our final raffle for the evening. So please don't leave just yet. So Michael and Dr. Good, please give your closing.
Thank you. So appreciate everyone taking time to join us. This has been great. And I've been so impressed, especially with the people who are up at the wee small hours of the morning to participate. You've had a chance to hear how we were able to continue operating despite the pandemic, and in fact, revitalized our operations and are expanding in new directions. So we hope to have an even more amazing report next year that will show more avenues of using telemedicine to improve healthcare around the world, following Dr. Good's vision. Dr.
The vision goes back to Albert Schweitzer, a physician who went to Africa and devoted himself in terms of humanitarian works. And what I realize is that it takes much more than physicians. And what Global Offsite Care has done for me is to expose me to people like Chemo and like Steve and Gail and Farine and many others, that what we're doing is other people outside of medicine and Rotary. Rotary is really the machinery behind what we're doing. It's the United Nations of what we're trying to do. And as I've seen this grow, we were sort of insular to begin with, Sebastopol. Now here we're really global, truly global, and we appreciate more you than ourselves in part. And I, as a physician, have learned to appreciate non-physicians who are guiding humanitarian efforts, and we're able to do more than Schweitzer could. He could do this in one hospital, one-on-one. We can do with telemedicine, one on thousands, if you will. So I think that the geometric progression we can do using telemedicine to take the benefits of medicine abroad and to come home also. It's a two-way street in terms of learning. One thing I'm going to emphasize this next year are medical students, because Farine is going to UC Davis. We're going to really open up some projects for medical students. Right now, we're developing an app with medical students from Western University that will be on a smartphone and give answers to questions regarding COVID-19. And I hope to have that really up and going in about a couple months. But anyway, it's been a pleasure dealing with particularly the individuals of Global Offsite Care who are outstanding and are enabling us to do a humanitarian pursuit that doctors couldn't do alone. We can do it with you. It's a pleasure.
Great, thank you.
With
both
that, I think,
very
Farine?
much.
Yeah.
Yeah, so we have one last thing for our evening, which is a $75 gift card raffle. So I will share my screen for to do that last one. So good luck, everyone. Thank you all again for staying with us for this hour, and let's see who wins it.
This one's moving faster.
And Farine, you stuck to the Shelley. Shelley Dino. Oh, she's a wonderful hospitalist.
Great. Well, congratulations to Shalene, and I will, send you a follow-up message for to get your gift card. I saw you, Doctor. I'm Wosa. I saw you, and I was like, you were so close. But again, thank you for joining. Again, it's also 3 or 4 o'clock in the morning for you, so really appreciate you joining us today. So for the kind of last little bit, I wanted to share with you all kind of our contact information, so you can just kind of write it down for those of you who may have joined us kind of for the first time to learn a little bit more about what Global Offsite Care and what Global Telemedicine has been doing. Feel free to contact us at contact@globaloffsitecare.org. Again, thank you all so much for joining, and we are so grateful for each and every one of you, for coming today, for supporting Global Offsite Care, Global Telemedicine, and we hope to see you at our May fundraiser. Please come to our weekly Global Grand Rounds. And again, if any of you would like to get more involved in our projects, we have quite a few projects coming up, and so we would love any sort of support that you may give, right? Whether it be with your time to volunteer or potentially helping us with fundraisers. So thank you all very much, and I hope you have a wonderful rest of your evening/morning for some of you. So thank you all very much.